Do you notice your mood dropping as the days get shorter and darker? Is winter a time when fatigue, sadness, and a desire to hibernate take over? You might be experiencing seasonal affective disorder, but you're not alone and help is available. Today's video explains the science behind SAD, practical ways to manage symptoms, proven treatments, and a message of hope for every season. What is seasonal affective disorder? SAD is a type of depression triggered by the change of seasons, most often occurring in late fall or winter when daylight disappears. It's not simply winter blues. Unlike mild seasonal sadness, SAD can disrupt your daily life, motivation, and sense of self, making each day feel heavy until spring or summer returns. A smaller group experiences SAD in spring or summer, but winter pattern is far more common. Why does SAD happen? SAD involves several biological changes. Reduced sunlight decreases serotonin, a brain chemical that boosts mood. Less daylight raises melatonin, which increases sleepiness and disrupts body rhythms. Low vitamin D levels from less sun exposure can lower serotonin further. Other factors include genetic tendencies, personal vulnerability, and negative thoughts linked to winter challenges or isolation. Common symptoms. Classic signs of winter pattern SAD include persistent sadness or low mood, fatigue, lack of energy, and slowed thinking. Sleeping too much, often more than 10 hours daily. Overeating, especially craving carbs or sweets, leading to weight gain. Loss of interest in favorite activities. Trouble concentrating or remembering. Feelings of hopelessness, self-doubt, or worthlessness. For some, symptoms appear each year, like clockwork, starting in the fall and ending with brighter days. Diagnosis involves a clinical interview with a mental health professional, tracking symptoms for at least 2 years during the same season and ruling out other causes. Proven treatments: light therapy. Most effective first-line treatment. Exposure to a bright light box, 10,000 lux, for 20-30 minutes each morning soon after waking. Mimics natural daylight, restoring serotonin and healthy rhythms. Results may appear within a few days, with full effects in about 2 weeks. Continue through the entire winter for best results. Note: people with bipolar disorder should consult a doctor before starting, since light therapy can trigger mania. Talk therapy, psychotherapy. Cognitive behavioral therapy, CBT, helps identify and change negative thoughts and habits that worsen winter mood swings and teaches coping strategies like scheduling meaningful activities, encourages healthy behavioral routines throughout winter. Medications. Antidepressants, especially SSRIs, fluoxetine, sertraline, or bupropion XL, may be prescribed if symptoms are severe or unresponsive to light or psychotherapy. Sometimes started before symptoms begin, in early fall, and continued until spring. Vitamin D. Ask your doctor about vitamin D supplementation, especially in areas with very little winter sunlight, to support serotonin production and mood. Everyday lifestyle strategies. You can make everyday choices to help recovery. Get as much natural sunlight as possible, sit near windows, use reflective decor, and take brief outdoor walks. Add regular exercise, especially outside. Physical movement boosts mood and energy. Eat a balanced diet and avoid excessive sugar or junk food cravings. Talk openly with loved ones about SAD. Social support is vital. Manage stress. Use relaxation, outdoors activity, or creative hobbies. SAD is temporary. Most people feel better each spring, but symptoms can return next season if left untreated. With light, therapy, medication, and support, recovery rates are very high. Most people find relief every year. Seeking help isn't weakness. It's the first step towards brighter, healthier days, no matter the weather. You are not defined by the season or darkness. There is light ahead, inside you and around you, waiting to be found and felt. Every winter ends, and every sunrise brings new hope. The darkest days hold the brightest tomorrows. Like the seasons, your mood can change, and you can bloom again. If this video brought you comfort or clarity, please like, share, and subscribe, because your story might help someone else see hope beyond the clouds.